New report from the CDC shows maternal deaths in the U.S. are surging, pretty scary, reaching their highest rate in nearly 60 years. While data from 2022 hasn't been released yet, more than 1,200 American women died of maternal causes in 2021. That was the third year in a row for an increase. And here with more is Dr. Frita Fisher. Good morning, Dr. Fisher.
Good morning.
Good morning. Why is this?
Oh, there are multiple reasons. One, the increase really started with the general female population after COVID. So you see the numbers in 2020, 2021, they rose exponentially. In fact, the 2021 maternal mortality rates increased by 60% when you compare them to 2019. And so we know that that's an issue. But really, a larger issue that's been going on is a lack of health access, a lack of good quality hospitals, and specifically with Black maternal mortality, Black females are 3 times as likely to die around childbirth than white women. And so we have some disparities that really have to be addressed.
And this is women who are dying during childbirth or while they're pregnant or shortly thereafter?
Well, the World Health Organization defines maternal mortality as death during pregnancy or within 42 days after pregnancy. And it's defined as how many maternal deaths per 100,000 live births. Okay. So in 2021, that number was 33 deaths per 100,000 compared to 2020 when the number was 24. And in 2019, it was only 20 per 100,000. So the increase is significant. And the U.S. actually has the highest maternal mortality rate compared to any other high-income country. We're the most dangerous country if you're in a high-income country to have a baby.
Gosh, I'm just blown away by this because it seems like, back in the day you heard my great-grandmother died in childbirth, but you rarely hear it today, but the numbers show otherwise. What's the solution?
The solution is looking at the preventable causes because actually 80% of the maternal deaths are from preventable causes. And so we want to look at comorbidities like obesity, like cardiovascular disease, and most important, healthcare. We want to expand healthcare to make sure that mothers are getting that prenatal care in the first trimester, or certainly in the early second trimester. And in rural areas, a lot of ladies don't have the proper access to medical care.
Dr.
So
Fisher,
most of it is preventable.
Older women or younger women? Because many of us are waiting later in life to have our children.
That's a great point, Ainsley, because there is a huge disparity. If you are over the age of 40 and giving birth, you are almost 7 times as likely to die than if you are less than 25. And so, yes, we have more ladies who are older who are giving birth. And of course, with the fertility treatments and the wonderful advancements, you have these older ladies, but also the older you are, the more likely you are to have cardiovascular disease. So that's a great point.
Okay. Dr. Fisher, always great to see you. Happy St. Patrick's Day.
Well.
You're wearing your green. Good job. Have a fun time. Have a great weekend. Thank you.
You as well.
Thank you. Okay, bye-bye.